I'm excited to welcome you to today's webinar from Two Generations Together on 2Gen data and evaluation. And we're glad to have with us Jose Villarreal from AVANCE. I will show you his title. There we go. And as you probably know, this is the fourth webinar in our Two Generations Together series. And we focused on a variety of topics over the last month or so. And if you've missed one, you're welcome to go watch the others on our YouTube channel or on the NHSA website. Our agenda today is to talk first a little bit for anyone who's new to this topic about what Two Generations Together is as a project and what it entails. Then I'll go through with you for a bit some of the terms and types of research we talk about when we talk about Two Generations Together. And actually look at some of the research base. What do we know about what justifies investing in whole families and in parents as part of our work in Head Start. Then we have with us Jose, who will talk about AVANCE Houston's work on data collection, which I think you'll find interesting. We'll have some updates on some other upcoming projects and webinars, and time to talk with you about what your questions and concerns are as you approach data and evaluation. For any of you who haven't heard me say it before, we're excited right now this month to be launching our Center for Policy Data and Research within our new website for NHSA. If you haven't gone to see it, I encourage you to do so. It's very exciting, possibly mostly exciting for those of us who helped make it. But really, the mission of the Center for Policy Data and Research, you'll see here on your screen, is at the bottom, is to curate knowledge about Head Start, to support Head Start programs as leaders, and to share their experience and wisdom, to generate new analyses and reflections, and to strengthen dialogue and collaboration between practitioners and researchers. And usually when we do these webinars, it's about this idea of sharing wisdom and experience from the field between programs, raising up local innovations to make sure that best practices are shared and understood across programs. But today we'll touch a little bit also on that last piece about strengthening dialogue and collaboration, because there is still an emerging research base for 2Gen work, which really lends itself to some opportunities for collaboration. If you haven't seen it, which I would be surprised if you have not, but our work with Ascend at the Aspen Institute over the past year has included the Two Generations Together case study report, which you can find on our website. The Institute, we had a full-day institute back in January in Washington, D.C. We had the 6 national program leaders who were featured in the report. We also had some experts from the fields of research, some leaders of higher education and workforce Two Generations efforts, some great voices all together, and it's all available to watch. Our webinars are there as well. And finally, the Learning Network now includes over 50 programs and a chance to really talk about what you're doing or what you're interested in doing in terms of being more intentional in your work with parents. Before we get into the main meat of our webinar, we've got a few polls for you today just to help understand how you're approaching this conversation, which we're excited to know so we can frame our remarks. So first, and you can choose as many boxes as you'd like, this should ask you, what kind of data challenges or questions is your program focused on? Are you trying to collect better data, to integrate child and parent data, to find databases, or to better connect data with different kinds of data? All right, I'll just give you another second. You can choose more than one if you'd like to. All right, so I'll close the poll there, and you should see it on your screen. So 90% of you said you wanted to collect better data about parents' outcomes. I think that says a lot about the tools that we have and don't have right now, and definitely something we'll be talking at the end about how we can improve our work in that area. 81% of you said you want to better integrate child and parent outcomes or parent and family outcomes, and a lot of the lack of a family here is just that I have a character limit in typing these out, but we absolutely recognize that families are broader than just the child and parents. About a third of you are looking for better databases. 43% of you want to better connect your data with other systems. And about 20 of you are thinking about connecting with other Head Start programs, which is an interesting idea as well. So now, rather than data questions, we're going to ask you about your research and evaluation work. Are you tracking longer-term outcomes for your students, tracking outcomes for your families over time, in actual 2-gen research projects, working on building some relationships for later research, or hoping to build relationships and do some future research? Again, you can choose multiple responses if you like. All right, so I will close that out and let you see. So really interesting here, the bulk of you, about 2/3, are tracking the outcomes for your early Head Start and Head Start children. And about the same percent, about 60%, hope to build relationships and conduct future research, but maybe aren't right now. We've got some smaller numbers who are building relationships or doing different kinds of research, which is fair too. We don't need every program to study the same model. That's not really necessary to build an evidence base, but important that that research is a part of Head Start work on the whole. All right, so one last poll before we get into our webinar. Which areas of 2-gen are you most interested in measuring or evaluating? The pieces about parents' education, parents' employment, income and assets, relationships between parent and child outcomes, or sort of the emergency services, the stable housing, healthcare, and food security? All right. And let's go ahead and close that. So this is fascinating to me and probably to the researchers here. 90% of you said that what you're most interested in is the relationship between parents and children's outcomes. Following that, we've got about 2/3 of you focused on the housing, healthcare, and food security, and then roughly half on the other 3 areas: parents, parental education, employment, income, and assets. All right, so with that, hopefully getting you thinking about some of the questions you might be working on over the next few years. Let's get into some of the terminology that it's going to be helpful to understand before Jose and I throw words around all over the place. Some of you may know these, and if you do, that's great. I just want to make sure that we're all speaking the same language. So as some of you may know, NHSA has been leading a working group around Head Start outcomes for the last 6 months. And we found it very challenging at first to have to define these words, because we use things like outcomes and impacts all the time, and we are not always using them the same way. So we talk about data broadly. All the information you collect about the children and families in your program counts as data. But there are different categories, really. There the output, which is most of the things that you put into the PIR are output. They're the things you can count easily. How many children showed up? How many children ate a meal on a given day? How many family home visits were there? Then there are the outcomes, the actual changes in the behavior. What the child learning by the end of the program year. Parents changing the way that they discipline their children or changing their routines at home. We also talk a lot about impacts, which aren't necessarily things that you're seeing at the end of your program year, but the long-term effects of Head Start. We know that our children are more likely to graduate high school, to go on to college, to be stable parents themselves. Those are really some of the impacts that we're talking about. when we use those terms. And you see that graphic there at the bottom. I can send you the report for that. I don't know the title off the top of my head. But that's what we sort of in our work have agreed to use as the slightly more standard definition. And if you have questions about that, happy to talk at the end. So some of the other research terms that we'll use, we throw around evaluation a lot, and I just want to show you that there are different types of evaluation, different ways of thinking about it. So first, formative evaluation is really that piece that you're doing during the design and launch of your program, trying to look at what's our logic model, is what we're designing in terms of programming actually reflective of that? As we start to implement it, does it really match what we said we were going to set out to do? If you have a chance to watch Educational Alliance's session from the Institute, you'll see them talk about this, that they were about to start something new. They thought, well, we're going to do a program evaluation from day one. We're going to get all of our impacts right away, measure everything. And they were working with a team at NYU who came back and said, well, we have to do some other things first. We have to make sure that we're designing the program to start out with in the best way to meet our goals. Then we have to track how it goes during those first couple of years. And all of you know this from when you started new efforts. The first year is a learning year. You have to figure out what's working, what's not working, what do we want to adapt. And then once we have a model that's solid during this formative evaluation frame, then we're ready to go on to the program evaluation. And so you'll see that defined next, the research on the outcomes of an established program, often part of generating the evidence base. You can think of the Head Start impact study, as much as we don't love it, as being an example of this, really looking at something that's been fully defined and what the results are. Finally, there's implementation research, which might not be a familiar term, which is often used during the scaling up of efforts to really understand, are the new replications of this program matching what was intended? Are they getting the same kinds of specs? What's going on? If you've looked at the early Head Start research and evaluation project findings, there was some implementation research done within that. And so in addition to just looking at what are the effects of this first group of early Head Start programs, they looked at how that varied based on the implementation of early Head Start. How did the programs that met the standards from day one, most of whom had some kind of first to three programming already, how did those programs compare to the other programs that hadn't done infants and toddlers before, who really weren't meeting the early Head Start standards until 12 or 18 months in? And actually, unsurprisingly, the programs that were meeting the standards had much better and longer lasting outcomes for their kids. And finally is the longitudinal research piece, this idea of tracking the children in a program or the participants in any study over a longer period of time, not just the end of the program year, but how do they continue to do over the course of time, usually in comparison to a group of people who didn't participate. And I will just quickly look at your questions. If anybody's got any pressing questions about that, feel free to type that into the question box on the side of your screen. All right. Seeing nothing pressing, I will continue. So the research base for Q-generation work has been established in a certain way, if you consider all of Head Start to be Q-gen since the 1960s. But there's also been some specific work focused on the programs that are the most intentional about the work they're doing with their families. So I'll just give you a quick overview of 4 of the studies that have come out over the last several years. And if you're thinking about how to go to funders in your community, or how to talk to your board, or how to explain to other people what is justified and why it's important to be more intentional in your work with families, some of this is a good source of information. So this first study, Q-generation programs in the 21st century, is actually more of a history synopsis really than a research study. It was written by Lindsay Chase Lansdale and Jeannie Brooks Dunn for the Future of Children. They did a special issue on two-generation work, I want to say last summer maybe. And that is free. You can access all of their articles for free, either on their website or you can order a copy. And really what they explore in this article is that the history of two-gen is complex. This idea of working with children and parents at the same time in the same program. It goes back, of course, to the 1960s, but there was an effort around dual generation in the early 90s, where programs that had previously been workforce supports for parents tried to bring in more of a consideration for how are we supporting their children. Do they have safe child care? Do they have good early learning programs? Some early childhood work at the same time started to intensify its work around parents. Then, of course, welfare reform happened. And a lot of these job training programs and educational programs for parents were quickly wiped out as parents were required to be working in order to be getting TANF. And so a lot of the energy around that sort of died off briefly. But in the recent efforts, and I should say that also there was some evaluation work done during that period on, and they go into this in length in the article, on the different models that didn't have across-the-board findings for families. A lot of them were sort of most effective with either the parents or the children, depending where the primary focus of the program was, but not as well balanced across the two. But in some recent efforts on two-gen that have been more focused on integrating really thoroughly both generations, there is some new research underway, some promising early results, but a lot of that is still fairly new. And even as you look through our Two Generations Together report, you'll see that most of the Head Start programs in there have begun their work around parent education and job training at the level they're doing it now, only in the last 5 to 10 years. So this next study is not actually from Head Start, but is a very good frame for why it's so important to be doing this work in a Head Start context. Catherine Magnuson uses this idea of linked lives to talk about how children and parents' outcomes are related, something all of you I know recognize from your work with families. And really also we know from the broad literature that children's outcomes are related to their parents' education levels and income levels. But in this study in particular, she looked at when young mothers got more education, when in their lives they got that additional education and what the effect was. And I'm jumping down a few bullet points, but the interesting thing is that the mothers who got their additional education when the children were younger, it had more of an effect. And that's really sort of what is suggestive to us that starting in that early childhood sphere offers the most opportunity, both because we see in this study that the mothers increased their education, the children's math and reading were stronger in elementary school, but they also increased the quality of the home settings that they were providing, which in that early childhood period may have been more important, potentially. The other thing that I want to highlight here, because it'll matter for the next slide, is that mothers who got more education tended to be those who had higher aptitude, greater self-esteem, and higher aspirations and expectations. So there may have been some features to the mothers who chose to go on to education that made them unique, that made them more likely to do this. And so when we talk in other contexts about the social capital work that Head Start does and the emotional and social support that parents get, where you probably have seen parents who've increased in these areas, these ideas of self-esteem and aspirations. It's interesting to think about how that may be contributing as well over time. The next study is from some folks here in Chicago who looked, this was some qualitative work. They did some interviews and some focus groups and Head Start programs in a couple states at which mothers were most ready for higher education, what did parents perceive as the real value of the supports they got for advancing their own education or skills. I think that the piece at the bottom is probably least surprising to you. Parents said that because their children were in Head Start, they themselves could build relationships, access information. They felt more like role models. And because they were less stressed about where their children were on a daily basis, they felt better able to meet their own needs. The higher readiness mothers were ready for that individual coaching, ready for progress into higher education. Some of the other parents were less prepared for college, but ready for life skills training and other support from their family service staff. And this highlights something that we talk about often in some of our two-generation conversations, which is this idea that just like with children, you're very unlikely to find a one-size-fits-all model for parents, even within one Head Start program. Parents come with all different types of needs, and so efforts to help people progress towards education and employment often have to have different starting points based on where parents are. The last study that I'm going to show you came out actually quite recently, just in the last 6 months, and used data from the Head Start Impact Study, so it's not all bad. And actually, I shouldn't say any of it's bad, because secondary analyses lately are telling us a lot more about how programs differ and what's really most useful and which populations Head Start is most effective for. But in this study, the authors, Terry and Lindsay, looked at how changes in parents' education differed for children who were either told they could go to Head Start or told they were not going to Head Start. Of course, that was the frame for the impact study, this idea of random assignments, but then not necessarily enforced. And so what happens is when you look at the children who enrolled when they were 3, by the time they were 6, the parents who were in Head Start were about 9% more likely to have gotten a college degree than parents whose children were not assigned to Head Start. That's great. And this is a national Head Start sample, remember? It's not a study just of a program that's focusing on getting parents into college. Some of these programs in the national sample probably work, but this is Head Start as a whole. In 2002, this was the effect, prior to a lot of the recent two-gen efforts. Interestingly, they didn't find the same impact for children who enrolled when they were 4. And they say in the article, possibly because just that 2-year window from 4 to 6 wasn't long enough to see parents reach that next milestone of graduation from the next level of education. The findings were especially strong for parents who had already had some college credit, really had that groundwork to go back to school once they had the stability of Head Start, and for African American parents. And their theory was that that might be because African American parents in the study were more likely to be in urban areas and to have access to a lot of colleges and community colleges in their communities. But other interesting questions still about what's driving those effects. And what they didn't see in these few years, they didn't see changes in employment. Although part of that was that parents weren't directly asked how many hours you're working more hours, or if your salary changed. It was just, are you employed or are you not employed, which doesn't fully give a picture of what's happening. All right. So the last question the last slide I'll show you before we turn over to AVANCE is about just some points about starting research. When we had our panel in this back in January, we asked the panel, which was both program leaders and researchers, how did you start your research partnership? And the folks from New York said, they knew somebody. They knew somebody on their board who knew somebody at one of the universities, and they reached out and said, can we talk about this? Can we explore this? And it ended up in this many years long partnership. One of the researchers who was there, Lindsay, who research you've seen, said, one of their biggest two-generation research studies, she'd written some other article, somebody saw her email address at the bottom of it and emailed her, and it went from there. So don't be intimidated, I think is the main part of what I'm trying to say. Invite folks from local universities to come visit your classrooms, to be in conversation with you, to brainstorm with you. Not everyone might be interested, but you never know. It could be a strong partnership and a lasting one. And then just that link at the bottom, if you're interested in being part of our research partnership database, you can find the link there to get involved, or go to the new NHSA website and find out more. And so with that, thank you so much for your attention. I'm going to turn you over to Jose Villarreal and his team from AVANCE. Jose?
Thank you, Emily. Can we give you a round of applause? Because yeah, I think I just want to mention that I have joining me today is my colleagues and my staff members from AVANCE, and so my comment to you was that they'll be doing the sound effects like laughter and sound and applause. But the other thing I want to tell you is I made this comment earlier to another workshop to Emily. I'm so glad that there's 13 or 20 some odd people, I guess, in the audience, maybe more. And anytime you can get an audience of that size to come and listen to a workshop or a presentation on data and evaluation at 1 o'clock or 2 o'clock in the afternoon, I always like to say, I must be in heaven. And so this
got about 35 of them with you.
All right, so we're in heaven today with all the people who want to listen to a presentation on data. So we hope you enjoy it. So here's, I think if we call this, you know, the title attributed to AVANCE was on data collection, and really to be fair, if I call it data collection for Head Start grantees and Head Start administrators, you already know about data collection. You do that every day, and you've been doing it for years and years. But really, I'm going to talk about data collection and how we use it, specifically as it applies to AVANCE, and where we have multiple programs, multiple funding sources. But Head Start, because of its size and its complexity, it drives the way we organize our data collection and how we implement it in our program. So I think you're experts in collecting data based on, you know, the work you do with your community assessments, your federal review, your QRIS, and other performance measures, and you also, you know, you take it to Policy Council and you take it to the board, and so there is some sort of a monitoring and improvement process that takes place even at this point. We may use different terminology and everything. And speaking of terminology, Emily, I really appreciate that you put a framework around all the different research initiatives at National Head Start Association, but also the different types of research. Because often you hear the term, so you're not quite sure what they're talking about when they're doing longitudinal studies and implementational studies and that kind of thing. So I really appreciate the way you've phrased it, and also given us that framework so that we, as we organize our own organizations, or if we try to make improvements, we kind of identify what we're trying to do by being able to say we're looking to be able to collect data or organize our information to fit this kind of study or that kind of study. And really one of the challenges that I see as we go through the presentation is how we fuse all these different data from Head Start, and we have lots of, not lots, we have other programs that are also fused into our Head Start model. In other words, we have healthy marriage, parent-child, adult ed, and fatherhood type programs, and workforce programs that are available to our Head Start parents, and we prioritize it, you know, the Head Start families as the recruitment group for all those different programs, and we also take families from the different programs and try to move them into Head Start if that's the sequence that they would follow. So what happens is you're fusing different programs who have sometimes different databases, and that's always a challenge. So if I can go to the next slide, you know, with any organization, it starts with your mission and it starts with your strategic planning goals. We're very much, you know, wedded to that idea, and we follow the strategic plan religiously. AVANCE's mission is to unlock America's potential by strengthening families and at-risk communities through effective parent education and support programs. So the reason I mention that is because the mission and the vision of AVANCE, it's part of our goals, it's part of our, I mean, it's part of our values, it's part of our culture, it's part of our vision. We have a 5-year strategic plan that we do every 5 years, and we follow it religiously. It's the method that we use to how we make our reports to the board, how we at staff kind of organize our presentations and our reports to as we grow through the year. It's part of our dashboard reports, for example. So on a monthly or bi-monthly basis, when the board meets, often the reports are done along the strategic plan outline, for example. We also have a 10-year vision committee, which are outsiders who are interested in the future of AVANCE, who are interested in the work that AVANCE does, but only not necessarily on our board. We have two staff members and 2 board members in a group of 20 who are, some are academics and some are business leaders, and they're looking at what's the future of Houston and what's the future of AVANCE, where does it fit in. But obviously having the right data and the right information and applying the data correctly is important to how that committee kind of develops its vision for AVANCE. That vision will become the basis for the next strategic plan. The strategic plan is important because it's the map that keeps everyone fixed in the same direction. It's how an organization, how a board guarantees stability and can weather changes, whether it's in leadership or in funding. So when we do 2-gen evaluation of data, it has a purpose, and the purpose is we're trying to collect data that actually measures our strategic priorities, which is children are school ready and parents are self-sufficient. And once again, I just want to make sure that in that strategic plan goal, we really have a fusion of 2 different groups, and that's the challenge of collecting data. You get data on children, you get data on parents, but we're trying to see how do those 2 fit together, and are they actually working? And because that's how we design our programs. So the next slide, just if I can go to the next slide, just kind of shows the importance of data collection and measuring outcomes. In our vision, we have in our strategic plan, we say, how do we operationalize our vision? Well, the way we're going to operationalize our vision is we're going to formalize outcome measures and formalize that process. We're going to develop plans for evaluation and data collection and provide outcome data from evaluation to support investments in AVANCE. And we just recently are adding the terms that we use at National Head Start Association, which is we want to also be able to measure for impact. So staff and even the board and the management and administrators have spent a lot of time over the last 2 or 3 years really trying to figure out, particularly like in MIS, how do we define these efforts that we mentioned here in terms of data, and how do we make the changes necessary in the organization to be able to arrive there. The focus on data, however, is there's 3 areas of focus that I want to. So all of us are in that phase. We collect data, and we've been collecting data for Head Start, and we collect very good data because it was part of compliance. And I know you'll agree with me. This is normally in front of an audience. I say, do you agree with me? And I'm hearing a yes from the audience. So, but normally we've done this for compliance. But in more recent years, we said, okay, we've got to add this to our quality improvement process. So for internal purposes, collecting data also serves our quality improvement. It's internal. We have data. So now what do we do with it? But on a long term, something that you mentioned, Emily, that's important to us, and we've added it recently, is we also want to measure impact. And that's because that's more of an environmental effect, because what you want to do is, how is the work that you do impacting the community where you live? How is it making a difference? And by environment, it means, we have to work with state legislatures, school districts, and funding sources. And in particular, even relevant today in Texas, is there are some bills before the legislature for a pre-K funding for all, which some of you have in many states, but not all states have it. So Texas is coming up with a pre-K for all. But in those position papers, they did take some, Head Start. They took some shots at Head Start. It's not being effective. Well, we have a lot of good talking points at AVANCE, and we can show that, in fact, that that's not correct, that they were using outdated reports and data, and that our data certainly challenges any misconceptions of Head Start's impact on the education of children. But I also want to tell you is that because of this, there is a commitment from the board also at the policy level in terms of making sure we have outcome measures, and it is part of their reporting method, and it's part of their what they expect to see when we meet, and and the progress we make throughout the year. If I go to the next slide, which is how we use the data, and it's called continuous quality improvement. So first, let me mention and kind of give a shout out to the National Urban Institute. I just got something recently from their communications team, which brought to my attention. It's a report issued by Dr. Teresa Derrick Mills, and the report, it's called Understanding Data for Continuous Quality Improvement in Head Start. Some of you are familiar with the National Urban Institute and the research they're doing and the evaluation of the designation renewal system. And they've got quite obviously they do a lot of other studies. But this particular study I would recommend to you, and I'll email it to you, the link to it, because it is relevant to where we are, and it's a good overview of what's going on around the country with Head Start agencies and the status of data collection. And there's some good recommendations on there also.
And Jose, ACF did fund them to do that work.
Oh, good. Okay. So one of the things that I want to mention to you is that part of the reason we added this piece is at the last board meeting and in earlier this year, United Way is one of our funding sources. So one of their questions to us is, how does the board get involved with quality improvement, with continuous quality improvement? And so we put together a process that we say it's formal, and in effect it answers the question, how do we formalize outcome measures, how do we formalize the data collection? So this puts a formal process together. But first you have to have a purpose. So we want to use the data we collect to improve services. So in our cycle of the strategic plan cycle for the year, you know, early in the year you set goals, then you kind of go through an implementation stage, then you review, you know, your implementation in terms of progress reports. So let me spend a little bit of time in how we do the review. The review consists of summits, which is the different staff coming together to kind of review how their programs are operating, how well this collective model of parent-child, Head Start, healthy marriage, fatherhood, it's all working together. Is there good communication within the organization? The educators will also come together and have a summit to kind of really go over something you're familiar with, which is the class scores, and we use gold in our particular setting to measure student progress. How are the parents feeling about it? And then also it's a summit of the executive staff. The executive staff is in fact responsible for sort of the fusion, because we've got different programs collecting the same type of data, and we're trying to make that uniform at this point. The summit is important because I just want to give you an example. You know, we collect data, and oftentimes we take the data and draw conclusions and make recommendations on the program. But you really need to check with people to see if what the data is telling you is correct. And the best example I have of that right now is really you look at all the reports we get on the economy of the nation, and I have certainly our economic progress, our condition. And it's always very robust. You know, the unemployment's gone down, manufacturing is up, exports are up, and you know, so those kind of indicators show that we have a robust economy. And we know that looking at data in Houston, we have tremendous growth in the GDP, the domestic product of Houston. And so it looks very, very rosy. But when you ask people, is the economy getting better? You know that people will tell you, well, yeah, more of us are working, but we're working part-time and we're making lower wages. So you need to have that kind of information to be combined with what the data that you collect is telling you. So in our continuous quality improvement, we also look at what year-to-year data is telling us. This is like the gold in the class. It's telling us it's data we collect every year. We collect scores of the grade scores of our kids when they go to kindergarten. So that's also a year-to-year data. But we're also looking at economic impact. So, and I'll talk about that. And that's where you're fusing. Gold is obviously the children. Economic impact is actually the parents and the families. And we also have often released to us. There's always we partner with a lot of organizations to do studies, longitudinal studies, and so we also get that information. So that all that information comes to us, and it becomes part of our CQI. So we will review that. And from reviewing from the summits and from the review and from our teacher our annual training that we do just before the beginning of the school year, we want to make recommendations for improvements. We want to revise our goals. It goes into strategic priorities, and the cycle starts again. So the purpose of this continuous quality improvement is to improve our services by looking at data and information. The how is we do the summits and we do the year-to-year data. And the what is we're still trying to make sure that children are school ready and showing improvement. That's fine, you can go to that. And that families are in fact moving towards self-sufficiency. So here's an example of just the class data. I'm obviously not going to spend time on the actual content, but just to show you a chart This was class data for the fall of 2014, the beginning of the school year. And the next one is actually the goal data on the next slide. Let's see if you can move to the next slide. Okay, that was the goal data at mid-year. And that's to give you an example that we're looking at data at different times in the year and then coming up with recommendations. So some of the recommendations will be on the next slide, for example, and it's shared with, so the data that we're getting back from Gold in class are also, in addition to administrators and others and board members and others looking at that results, it's really valuable to the teachers and center administrators that they get the feedback. So I think one of the comments from the National Urban Institute study is that we've got to create safe spaces so that when you're getting feedback, you can actually use it to improve your program. The teacher can use it to improve her classroom and her lessons, and the administrator can also improve the scores of the children in their charge. So on goal scores, the teachers receive individual child reports, classroom reports, and it also gives them material to be able to say, for example, use in their parent-teacher conference, or it gives them some ideas of what kind of materials they need to order for the school year to be able to help reinforce some of the areas where they have some weaknesses. Class is a little different, but we share those scores and observation note with the teacher twice a year to be able to, again, improve the relationship between the teacher and the teaching style and the environment that they're in. Those scores are actually shared with the administrator and the teachers. It's the teacher and the educational specialist, and there's a school readiness advisory committee that review the scores, and they work with the teachers and the center administrators. It's not done on a supervisor to employee basis because that's not a safe space, but you want to create it in the best and most positive surroundings you could do. The outcomes from all of that is incorporated into training. We also do a teacher survey in May, which is incorporated into the summer training for the coming year. So if I can go to the next slide. So here's an example, and it's an excerpt of the action plans that came out of the teacher and administrators and the score. So children will exhibit in continuous progress in gross and fine motor skills, et cetera, et cetera. The outcome is that at mid-year we said we want a 30% increase in performance and growth in physical language by the end of the year, and we want teachers to have a better understanding of age-appropriate activities. So that's an example of the class and goal scores, and obviously that piece I've been talking about there applies to the children. On the next slide, I want to talk about, let's see, I think correct, okay. So here's the challenge and what we're trying to do. So the challenge is we have the top one is it's a longitudinal data. So one of the partners in our longitudinal data is our school district, which is doing a 10-year tracking study of Head Start kids, and it's math and science scores, math and reading scores. I'm showing you the math scores for right now. And so what they're doing is we get kindergarten scores every year for the class that goes into kindergarten. We are getting third grade scores, and this is the first cohort to reach third grade. We'll also see their scores when they get to 5th grade and to 8th grade. But it's a 10-year study, so from this point on, that we will be getting third grade scores. So in this particular setting, it was good news to us because it basically says that in the AVANCE Head Start children who go to HISD were scoring higher on their math scores at 3rd grade. And the conclusion from their study from HISD, so it's a third-party study, it's a fairly sophisticated, in-depth, longitudinal study. And so it basically says their conclusion, the difference is significant, and they want to look into why AVANCE's children are actually scoring higher than, in fact, the other children in HISD. The second one is, we have a lot of parent engagement, and our signature program for parent engagement is called the Parent-Child Education Program. Again, it's 9 months. The parents come in once a week, and the children are in an early childhood education setting. The children are aged 0 to 3. So it's moms that are expecting or with children under 3. That's the requirement to get in. This is predominantly Latino immigrant families in this program, and we call it the Gateway Program. This is where they start, and then what we try to do after that is encourage the parents to go into English second language, or we encourage the parents to put their child in early Head Start or Head Start if they're eligible for that. But what it's showing is that of the children who belong to that were in the parent-child education program. So this is a survey-based evaluation of the program. So they talked to 300 families who have been in AVANCE programs, and some are in Houston, some are in other parts of the state. And so of the families that were involved in AVANCE, 93% are saying that their children were school ready. What we're showing, and it's consistent with another study done earlier, maybe about 10 years ago, that 90% of the children stayed in school. This is 8 to 10 years out after the program. But we know in longitudinal data that we're tracking somewhere else. There's a school district in Dallas that shows like a 93% high school graduation rate for children who were in parent-child program. So it compares to the state's rate, which is running about 67 to 70% for Latino and African American children. But parents obviously want to improve their employment. What the graphic here shows the number of parents that advanced their education, which was 40%. It's also, I took one piece out, but it ties into what you just said, Emily. In parents who had some college, they went on to finish college at a very, very high rate. It was about a 300% increase, meaning, and I know the number. So of the 300 parents that were interviewed, 6 had some college when they started at AVANCE, and 8 years later, it was 19 had gone back. So the total, so some of them went back to school and finished, but it was like 19. So the increase in the number of parents who went to college went from 6 to 19 from that sample. That's consistent what you were just saying earlier about if you get involved with a child at 0 to 3 in your early Head Start data, and so that the likelihood of the parent going back to college or finishing college is much higher. And so I like that because it kind of says we have sort of a similarity, but this is a place where we can have some, I'm calling it fusion, but what I'm saying is there's correlations you can make between what you're getting in the parent-child program and what you're getting with the rest of your population sample and trying to interpolate. I say that because in the National Urban Institute study, it kind of one of the recommendations is that Head Start agencies, we need to build our capacity and strengthen our capacity to do analytics. And so I think it's important as the sophistication of Head Start agency grows to be able to perform analytics by combining different types of data, especially when you're trying to do 2-gen data, because we have children's data and we have parent data, but trying to get both is really important. So, and the AVANCE evaluation also is a good example of, I think, of the parent and child data together. And it's not super sophisticated because it's a complex issue, so you want to keep it at least keep it clean. So the next slide really is we're starting to look at economic impact of the parents who are in Head Start. So this is for the last 3 years. 3 years ago we started looking at income data. Last year we kind of did sort of a base year, and this year we're actually measuring what we think is a pretty comprehensive sample. Well, we have everybody's income when they start. We can't always get it when they finish the school year, but when we get a pretty good sample of the number of families and how much they're earning. But what this tells you is we were looking at income by center, so I kind of have this slide out of place, but it's a good indication of what happens. Essentially, you have 6 centers represented on the right and 4 on the left. The reason was that 2 of those centers are early Head Start centers, and the families were not working at all. So you can see what kind of a big difference that makes in total income. If I go to the next slide okay, so you're very good. So this kind of tells you the difference of income at the beginning of the school year, which was the average income for a Head Start and early Head Start family was, I think I'm seeing 863. What's the number? 883, I guess is what I'm seeing. And then at the end of the school year, it's obviously a $1,100, so it's almost a $300 difference. And when you translate that to 2,000 families, it has an impact of about close to $8 million a year. So it's significant, and it's data that you can use within your own community as far as impact. In other words, looking at, and that's why. So it's I think here you mentioned how do we help Head Start agencies And as I was listening to the sort of the closing remarks you were making, Head Start agencies have very good social capital. I mean, we have relationships we have everywhere. So trying to get a study done, when you have this kind of data, you'll find takers. We have relationships with schools. We have relationships with colleges. We have relationships. So there are partners out there willing to work with us. This particular one shows the income difference, and the next one shows the employment data. I think one of the things that's interesting here is just to show the difference in median household income at the beginning of the year for a Head Start family and the median income for families in Houston during the same period. The big picture here is we're trying to show the difference in employment. So from the beginning of the school year to the end of the school year, the employment rate goes up by 22 percentage points on the first two bars. On the last bar graph, it's actually the last two columns. It's about a 30% increase in the number of people who go to work. That's additional income being earned, people getting off of some of the subsidized benefits. So there's a big economic impact. And what I would recommend in terms of social capital is you try and bring people from the like your workforce boards, economic development boards, or the Chamber of Commerce on your board, to get them on your boards, on your advisory committees, because they will promote this data. This is really, you know, if you convert it to dollars and cents per year and how much buying power that has, it has some very good impacts throughout the whole community. So the next slide.
Okay. I just want to let you know we've got about 5 minutes until we take a couple questions.
Right, I'm just about at the end. So the next one is just looking at self-sufficiency. I just put a quick slide up there on our GED adult education program, who's going to college and who's not. And what I want to say here is we have a college-bound initiative that applies to our GED students. We're trying to get our early Head Start students into college. There's a group of early Head Start students that are in high school, and all our employees are also. We encourage very strongly all our employees to go to college. The idea is you have to model what you tell your clients you want to practice. So that's an important piece. The other piece I want to tell you is you got to track it way 3, 4, 5 years out, because it takes that long for someone to go from the GED program to get into college. Sometimes we try to get as many in as we can. And the idea is to really show the impact of your program. You have to go collect additional data that's not required by your funding sources. It's not compliance. It's just really data for impact and data for quality. The last slide is the next one. Second to last slide is partners. Again, we talked about school districts as being partners. Universities, you can go to early childhood education departments, graduate schools. Usually they're looking for places for interns. We're fortunate to have two medical schools here in Houston who are always interested in doing nutrition, brain development, and their grants department usually works with us. Baylor College of Medicine, I pulled these two studies up. There are about 5 studies that we've been involved with over the last 5 years, but these 2 studies are 2-generation studies on nutrition and self-regulation of intake for children and how parents work with their children. The last one is you can issue out an RFP. We've done that. It's not very expensive if you work with a university. So it's a proposal for longitudinal study with AVANCE Houston Inc. families. And then so there was a proposal that came from somebody at the Mississippi Valley State University. That's a university, in another state, but nevertheless we have a very good, they're partnering with another individual researcher here in this area. So we have a good proposal at a very low rate that'll tell us a little bit more information about our families, particularly our 2-generation approach. And the next slide is the last one. So basic in collecting data and trying to figure out how you use it, you want to measure what you know. So we have data, we're familiar with it, we know what we can measure, and then it says know what you measure, which means to me that you really have to, it's kind of the why, right? So the why is that you really want to look out for the future, where you want a future where children and parents advance their full potential, transforming the communities in which they live. And so the idea is you want to be able to show that we're making that kind of progress. So I'm going to stop at that point, and yes, we'll take questions too. So thank you, Emily.
Okay, for everyone who's on the line, thank you so much. For everyone who's on the line, if you have questions, go ahead and type them in the question box on the side, and we'll read them out. While they're doing that, Jose, I wanted to ask you if you would speak for just a minute. I know you've done some work on selecting a database to try to capture some of your child and family outcomes together. I know that that's still an evolving process for most of the folks who are doing it, but can you just say a few words about how you approach that process?
Sure. So one of the things that came out of, by the way, of the National Urban Institute is it talks about you have to build analytic capability. So one piece that's important, if you can build it in, and is, particularly if you have a good significant size budget, is we have created a research department. So we're collecting data every year and recording it. Well, one of those is our study with, in conjunction with Houston Independent School District. It is a 10-year agreement, and we're tracking our kids. We know what they score when they leave AVANCE. We know what they're scoring when they get into kindergarten, and now we're getting the third grade scores back. So that's kind of another piece of how we create that database. And we have a study from, every year we get a study and a report back from HISD and how our kids are, how the children from AVANCE are doing, because we're getting their kindergarten scores and we're now going to get their third grade scores. And so that's going to be over a 10-year period. I think that's what you're referring to. There's other databases that we collect. Go ahead. Anthony?
The other piece that I was going to emphasize is I can't remember if you were using Child Plus or Prism or one of these to keep the family data with it.
Right, yeah, and Anthony was just giving the comment. I'm going to ask you if you want to answer. That's okay, but let me just start with, we use Promise database. We're looking at different softwares. So what's coming from the FDW and summits and the Teacher Summit is that we need a better software that captures our family, 2-gen data more effective than we can do it in Promise. So we're looking at different database, different softwares. So one that we're considering right now is CapPro, and I know some of you use it. Every software has some strengths and some weaknesses. So there's some weaknesses. We've done some by using Promise. We've been able to collect the data and analyze data from say Healthy Marriage, Adult Ed, GED. And we can tell, the cross sort of referencing between programs, but it's still a lot of manual work involved. I mean, we still have to go to a spreadsheet, do an analysis and stuff. But the fact that Promise can kind of keep track of the different generations, but it's not the most effective way. We hope we can get some improvements on that. And we're working with, I know a couple of other individuals. I know Gail in Minnesota, but I thought, I'm trying to think Lynn's last name, but Lynn from very good, from the CAP agency in St. Paul, Minnesota. It's called Ramsey Washington. Has some very good. She actually created what's called a pivot program that is able to track parents and children. So I thought that was a very good system, but it's her own creation basically on that. So
Lynn wrote.
Yeah. So does that answer the question?
Yes, thank you. And you did get a question from the audience. Afia asked, what is the best method to implement a CQI process for a new Head Start program? If you had to start from scratch, where would you start?
Let's see. Okay, I would say because you're required to have a community assessment, for example, and to kind of take a look at your what your parents are saying, also look at what your teachers are saying. And this is your base year, so you collect data on that, and really you want to involve your parents as much as possible in giving you some feedback on the programs, involve your teachers. So at the end of the year, you look at that information, and you start by saying, you go to your board and say, or your funding sources, say, here's what we're going to concentrate on the second year of the grant, because we found this out in our first year. So this is what we concentrate on, and you kind of report on that periodically to your board. And then the other thing is you're going to have to put together a strategic plan for the organization and figure out how your information, the data feedback, the information getting back from your data, how that fits into your strategic plan. So that's his best. I also would say, Emily, I would make myself available if someone wants to call, and we can pick up a little more detail about their status also.
Great, thank you. All right, so before we leave today, I do want to just let you know about a new effort underway, and I'm actually hosted today by the National Opinion Research Center at the University of Chicago, where I'm on this call from. And Mark is here with me. Do you want to say a couple words about the project that they might get called about?
Sure, thank you very much. So a new project starting really this week, where this project was developed in collaboration originally with the Region 5 Head Start Association Executive Directors, and now is also involved the National Head Start Association, where we are going to be developing a tool that can measure for Head Start grantees and early Head Start grantees, that can measure at the family level, parent-family community engagement. And there's really two parts to this project, and the first part, which will be starting collecting data this summer, which is to get original narratives from parents who have participated in Head Start and early Head Start programs over the last year about their experience engaging with their program. So this is really, it's original work where you may be invited to participate. We're going to be collecting narratives from around parents and families from around the country, and as you can see here, we're thinking about 10 per, I think it was program region.
So they're selected, they wouldn't be asked to submit more than 10.
Not more than 10, so a small number of stories. Selected from parents, and we will do analysis. I think in total there will be about 100 worth of data that we'll be collecting, and we're going to be analyzing those over the fall to really understand from a parent's perspective. Number one, how are they engaging with their programs? What are their feelings about their engagement? What successes or challenges they had? And then once we have that information, we'll be analyzing those aspects off that start CF framework, and then creating this tool, which will be a web-based tool that grantees will be able to use to track parents' engagement in their programs and their activities. And given that the interest is very interesting, one of those polls, 90% of people are interested in being able to tie CFPD activities to child outcomes. It's not a part of this current project, but it's certainly the next step. So we have a tool that can objectively and reliably measure parents' engagement over time, over the course of the school year, or for however long they're involved in the program. We can then tie that data to the administrative data that's currently collected on child outcomes, and say empirically which activities are having the biggest impact on child outcomes and for particular programs, age type parents. So that's a new project, and you may be hearing from us over the next few months, and we really appreciate your participation and help with that.
Thanks, Mark. So just the last thing, and I know some of you probably have to run. We did get a last question, is there a 2Gen database that I can use? Unfortunately, that's what folks doing this work are trying to figure out right now. People are sort of amending different databases in different ways, but there's no easy answer yet. If you come up with one, let the rest of us know. The next couple webinars are there on your screen. You can also register at the NHSA website. The link is there at the bottom. You'll see a quick survey when this ends, and we hope that you'll take just a minute to let us know what you thought and what questions you still have that we can answer in future conversations. Thanks to everyone for being with us, and thanks to Jose for sharing the AVANCE model.
Thank you. Thank you.
Have a good week.